Colonoscopy procedure typically starts with your primary care physician referring you to a gastroenterologist to schedule a screening colonoscopy. So you come to the gastroenterologist's office, he or she goes over your medical history, explains the procedure to you, the risks and benefits, and goes over the prep instructions. The prep for the procedure starts usually the day before. So the day before the procedure, you'll be in a clear liquid diet. Clear liquid diet includes stuff like popsicles, Jello, Gatorade. Tea and coffee can be included, except there is no dairy or creamer allowed. Typically, you can do either the whole prep the night before the procedure, depending on when the next day your procedure is scheduled. If it's scheduled early in the morning, it makes sense to do the whole prep the night before. If it's scheduled later in the morning or in the afternoon, then it makes sense to split the prep, where you take half the prep the night before and half the morning of the procedure. The prep typically has to be finished 4 to 6 hours before the procedure. Typically during a colonoscopy procedure, you will not be awake. You will be in a sleep which we call the twilight zone. So you'll be given medications to sedate you, but it's not general anesthesia, meaning that you will be breathing on your own and your cough reflexes will be preserved. Once the procedure is done, you wake up within 1 to 2 minutes and you are pretty wide awake. Most patients have minor abdominal discomfort and some bloating, and by the time they're leaving the endoscopy suite, they're feeling pretty good. And you will be groggy for the rest of the day, and we highly recommend you do not go to work or drive after the procedure. But after a good night's sleep, most patients are feeling pretty good and they can resume their usual activities the next day. We recommend that you eat soft, light foods which are not greasy, oily, or spicy, because it might discomfort your colon. Colonoscopy results are typically available right after the procedure. Your gastroenterologist will give you a report which will mention if there were any polyps found and they were removed, and the report will be available right prior to discharge. Now, if any polyps were removed, they are sent to the pathologist for review. If any biopsies are taken, they are also sent to the pathologist for review, and that report typically takes about 2 to 7 days to come back, depending on the center. Polyps are these small nubbins of tissue which form in the colon, and they can develop into colon cancer. And that's why we perform the screening colonoscopy. Polyps are removed based on their size or location. There are various devices which can go through the colonoscope to remove the polyps. Typical ones used are biopsy forceps and a snare. The most important part of the colonoscopy is what you do at your home, not what I do, which is the prep for the procedure. That's the hardest part. So if the prep is not good, then I can't do my job very well. So I highly recommend that you follow the instructions for the prep to the T and get a good prep and get a good colonoscopy.